It's September 2025. COVID is still with us. But the fear, the panic, and the lockdowns are gone. Why? Because the war has changed. We're no longer fighting a surprise attack. We're in a new phase of strategic defense, powered by technology you can use right from your living room. Hi, I'm the founder of Palm Health, Jacksonville's first AI-centric clinic. For the past 5 years, we've learned invaluable lessons. We've moved from reacting to a global emergency to proactively managing a public health challenge. Today, we're cutting through the noise to give you the 2025 briefing on COVID. We'll explain the upgraded vaccines and treatments, demystify long COVID, and give you a concrete battle plan to keep your family safe and resilient. This is your guide to navigating the new normal with confidence. The new battlefield, from hurricane to weather forecast. Since 2020, when the pandemic hit like an unexpected Category 5 hurricane, our ability to predict the virus has dramatically improved. By 2025, advanced tools like wastewater surveillance, genetic mapping, and symptom tracking apps function like satellites, spotting new variants before they reach us. This shift has turned a global crisis into a manageable local issue, replacing broad lockdowns with targeted advisories. At Palm Health, we use these viral forecasts to guide members on when to take precautions, much like checking a pollen warning. The upgraded arsenal, vaccines, and at-home treatments. Our tools to fight the virus have become incredibly sophisticated. Vaccines 2.0. The immune system, software update, analogy. The 2025 mRNA vaccines are no longer a one-size-fits-all solution. They're like a critical software update for your immune system. Each annual or semi-annual booster updates your body's virus definitions to recognize multiple new variants at once, not just one outdated version. This provides broader, more flexible immunity. For high-risk individuals, specialized vaccines offer enhanced protection, drastically cutting hospitalization rates. The at-home COVID care kit. The focus of treatment has shifted dramatically from the ER to your living room. For mild to moderate cases, we can now deploy a powerful at-home care kit under medical guidance. This includes highly effective antiviral pills, targeted monoclonal antibodies, and even new inhalable therapies that stop the virus in the respiratory tract before it can spread. This is a game changer because research has definitively shown that starting these treatments early significantly reduces the risk of developing long COVID. This is where our direct primary care model is crucial. Our members don't wait in an urgent care line. They send a text, get a same-day telehealth visit, and we can immediately prescribe and guide them through using these life-saving at-home treatments. The lingering echo, demystifying long COVID. Even though the acute phase of COVID is far less dangerous in 2025, long COVID remains a serious concern. The most well-known symptoms are the trio of crushing fatigue, persistent brain fog, and shortness of breath. But the reality is much broader and more complex. Long COVID can manifest as a frustrating constellation of issues affecting nearly any part of the body. Patients can experience chronic headaches, heart palpitations, joint and muscle pain, digestive problems, and lingering changes to their sense of taste or smell. For many, the condition also brings a heavy emotional toll with increased rates of anxiety and depression. Analogy. Think of long COVID like a software bug left behind after a computer virus is deleted. The main threat is gone, but it left behind corrupted files. This doesn't just cause one error, it can create glitches across the entire operating system, from your neurological processors to your cardiovascular power supply. This is what causes the whole system to run slow, fatigue, or apps to crash, brain fog. Testing and treatment in 2025. A new hope for years, diagnosing long COVID was a process of elimination. But by September 2025, science has given us concrete tools. Testing. We now have advanced blood panels that can identify specific inflammatory biomarkers and autoantibodies associated with long COVID. This allows us to move from a subjective diagnosis to one based on objective data. For specific symptoms, we utilize functional tests like autonomic nervous system evaluations for POTS, like symptoms, or neurocognitive testing to quantify brain fog. Treatment. A multi-pronged approach is now the standard of care. Treatment is highly personalized, but often includes a combination of tailored medication regimens. This can include medications to manage specific symptoms like heart palpitations or nerve pain, as well as emerging therapies like low-dose naltrexone to help modulate the immune system's inflammatory response. Structured rehabilitation. This is more than just general exercise. It includes specialized physical therapy with a focus on pacing to avoid post-exertional crashes, cognitive therapy for brain fog, and specific breathing exercises to improve lung function. Nutritional and supplement support. We now focus on strategies to reduce systemic inflammation and support mitochondrial health, the powerhouses of your cells. This involves anti-inflammatory diets and targeted supplements like CoQ10 and omega-3s. Palm Health uses a data-driven approach to long COVID care. By monitoring wearable data like sleep, heart rate variability, and activity levels, their AI system flags early risks. This enables timely biomarker testing and personalized rehabilitation plans, helping members recover and restore their systems effectively. Fortifying your base. Proactive home defense. In September 2025, prevention is about building a resilient home and a resilient body. We've learned that we have an incredible amount of control over our personal environment and our immune readiness. Here's how you fortify your base. 1. Clean the air you breathe. Since COVID-19 is airborne, cleaning indoor air is a crucial defense. HEPA filters trap over 99.9% of viral particles, making high-quality air purifiers essential for living spaces. Placement matters. Run purifiers on high, especially with guests, to maximize clean air circulation. Simple ventilation also works. Opening windows on opposite sides of a room for 15 to 20 minutes creates cross-ventilation that significantly reduces indoor contaminants. 2. Build your immune resilience. Your lifestyle is your immune system's armor, and daily choices shape your resilience. The immune trinity, vitamin D, zinc, and vitamin C, plays a key role in regulating, repairing, and protecting immune cells. Sleep and movement are non-negotiable, with 7 to 8 hours of rest and regular exercise boosting overall defense. Stress management is equally vital, since chronic stress weakens immunity. Even short mindfulness practices strengthen protection. At Palm Health, we test nutrient levels and lifestyle factors to create personalized resilience plans, ensuring your body is ready before threats arise. The Palm Health Advantage, navigating 2025 with a co-pilot. The pandemic accelerated the rise of digital health, and this is where our model excels. By 2025, telemedicine, remote monitoring, and AI-driven insights are a part of daily life. Analogy. In this new world, our AI platform acts as your personal early warning system, analyzing data from your wearables to spot trouble before you feel it. But data without guidance is just noise. That's where your DPC doctor comes in. We act as your mission control, your human co-pilot who interprets the data, explains what it means, and helps you make the best decisions for your health. The world in 2025 is safer and smarter because of the hard lessons we learned. The virus is still here, But our advanced tools, at-home strategies, and deeper understanding make it manageable. By staying up to date on vaccines, fortifying your home and your health, and partnering with a proactive medical team, you can navigate life in this new normal with complete confidence. COVID changed our world, but it also armed us with the knowledge to live healthier, more resilient lives. If you're ready to embrace the future of proactive, tech-enabled healthcare, click the link to learn more about our approach at Palm Health.